Now, if you need any more evidence that the Canadian welfare state is broken, look no further than the Canadian Dental Care Plan. Now, at Kibono, we administer health spending accounts. And why they're valuable is because rather than having a complicated benefits arrangement with booklets, limits, categories, premiums that go up because employees are incentivized to claim more against the plan than the employer is paying in premiums, a lot of employers these days are transitioning over to health spending accounts. I give Jim $2,000 a year and he can use it towards whatever he needs. As you know, we also in Canada have the Canadian Dental Care Plan. This is what it does. Federal initiative designed to reduce financial barriers to oral health care for uninsured Canadian residents with a household income under $90,000 a year. Basically, the intent is simple. Give people access to dental care who don't have access to dental care. That plan is actually administered by the government through Sun Life. Also makes no sense. Why is an insurance company administering dental transactions when you could just submit your dental receipts through your taxes, but that would be way too simple. What's interesting is that over the last few months, we've been getting a lot of requests from clients who say, well, you know what, my employees, I still want to give them access to the Canadian Dental Care Plan, or I have a plan. How do I still provide benefits and give my employees access to the Canadian Dental Care Plan? And I said, well, you can't. The whole point of the Canadian Dental Care Plan is for people who don't have benefits or companies don't provide benefits. And by providing benefits, you remove access or should be removing access from the Canadian Dental Care Plan. Well, what insurance companies and a lot of administrators are apparently doing these days, because this is the word I'm getting from clients and I'm trying to compete, is they're actively excluding dental. And once dental is excluded, it means they no longer have access. And once they no longer have access, they can now qualify for the Canadian Dental Care Plan. Now, totally understand why business owners are doing this. If I'm paying for the Canadian Dental Care Plan through my tax revenue, why should I pay and finance my employees' access to dental care through the benefits plan? And that's fine. But at the end of the day, removing dental from a health spending account clearly is circumventing the rules and the intent of the Canadian Dental Care Plan. Now, as someone who does this for a living, I want certainty. So what did I do? I requested a technical interpretation from the CRA. I put this letter together and basically say, does the CRA consider the existence of an employer-sponsored HSA itself to constitute access to private dental coverage? And it should, at least in my opinion. This, in my opinion, is clearly. And interestingly enough, I got a call back from the CRA just a couple weeks later, which is, ironically impressive on its own, considering how much a lot of people rail and crap on the CRA, basically saying that this is under the auspices of Health Canada. All the CRA does is effectively provide data to Health Canada to make sure people meet the income qualification to receive Canadian dental care benefits. Now, CRA calls me. They say this is really not under their purview, yet alluded to the fact that they think it's bullshit, and gave me the number to Health Canada, specifically in the context of the Canadian Dental Care Plan. So what do? I give them a call. 1-833-537-4342. Get on the line with someone, and this is what starts to make my blood boil. I asked the question directly. I know this guy was very nice. I asked the question directly. If someone has access to an HSA, but the employer removed access to dental care, can they now access the Canadian Dental Care Plan? And he basically said to me, well, I do believe that what the employer is doing is circumventing the rules, but if an employee can prove that them and no one in the business has access to dental insurance, then we probably consider it lack of access to dental insurance. What was interesting was that he asked me and specifically referenced an individual situation, meaning when one person reaches out, that person would have to prove, and the employer would have to prove, that their employees don't have access to dental care. Ironically, the employees do. By virtue of an employer having a benefits plan, in my opinion, it should be considered access to dental care. We now have a situation where business owners are arbitrarily removing access when it was previously provided. So employees can have dental insurance through the Canadian Dental Care Plan. I was given no information as to whether or not Health Canada will come out with an official ruling or deal with this in the near future. I've sent letters to the CRA about other things and haven't heard from them in years, so I doubt anything will happen soon. This makes my blood boil both as an HSA provider and as a taxpayer. As an HSA provider, just give me some fucking rules, because I'm trying to follow them and you're not making my life easy. Secondly, as a taxpayer, what the f***? Like, this is such a mess. If you want to help people with their dental expenses, do it on their taxes. You're already doing that with the medical expense tax credit. Say to Jim and John, send us your receipts for the dentist, and the first $2,000 a year you spend at the dentist, we're just going to give you a refundable or non-refundable tax credit. You don't need to use Sun Life. You don't need the complexity. You don't need the Canadian Dental Care Plan. You just need to offer income tax refund. But no, that would be way too simple. As someone who sells HSAs, I have no clarity on what the I'm supposed to do. It's really frustrating. Like, why do you even need this? Everyone right now has access to the medical expense tax credit. You submit your eligible medical expenses and you get a refundable tax credit after a certain deductible. There's no insurance company. There's no complexity. There's no health plan part of the government administering this. It's just if you have receipts and if it meets this definition, we'll give you the money back. Why can't the Canadian Dental Care Plan be that? Why can't you just say to Canadians, hey, the first $1,000 or $2,000 you spend a year at the dentist up to a certain income threshold, we give you as a refundable tax credit. Why do you got to use Sun Life to administer the plan? Why do you need the complexity? And even worse, businesses in Canada going forward will start circumventing the intent, circumventing their benefits plans so their employees utilize the tax system to get dental coverage and not benefits plans. There's no way that this was thought out enough. There's no way this will go on long term. And if it does, it just continues to destroy my faith in the Canadian tax system as a whole. Just shame on us. Rant over.